Hi, and thank you for joining us right here at Breast Cancer Answers. You know, in 2011, I approached Dr. Jay Harness, a past president of the American Society of Breast Surgeons, because my stepmom was diagnosed with breast cancer. And I knew that with my digital marketing background and Dr. Harness's experience and wisdom in the breast cancer field, that we could help women all over the world. And the campaign quickly went viral, and then somewhere around 7 million video views, my loving wife became the next cancer patient, breast cancer that is, in the family. And so to talk about what we discovered in year one in the hopes that it can help you or your loved ones better fight against breast cancer, well, Dr. Jay Harness is here and Wendy Hartley. So let's start off. Hi, Dr. Jay. How are you?
Hey, Todd. Great to be here as always.
Nice to have you here, my friend. And then Wendy, thanks for joining us on your 1-year anniversary of diagnosis.
Good morning. It's a true honor. It's an honor to be here. It's an honor to be on the other side of the journey. And just coming from the background as a yoga instructor, what I would teach my classes about being in the poses, the asana, and working with our habitual holding patterns and our mind habits, the art of accepting what is going on in our life while it's going on allows us to have this softening that occurs from the inside. We're not forcing the river, we're becoming one with the river. And I just remember those words that I shared for so many years while I was having a biopsy. And in that moment of having the biopsy, I looked up and said out loud, I'm like, God, I'm not asking you to not give me cancer because I know you know what I'm going to do with cancer. So I artfully had that opportunity to practice what I was teaching wholeheartedly and surrender into whatever needs to have happen, and to be careful not to judge anything beyond the present moment, because I did not have enough information or resources to have it happen. And I tell you, I never had a moment where I said, why me? And I think part of that was right after we got diagnosed. I say we because Todd was so much in the forefront of my journey. And right after we got diagnosed, we were in the office, we headed home, and I said, I need to watch something that inspires me. Todd turned on Crazy Sexy Cancer. We watched Chris Carr's journey. And then we said, let's go have a date at Whole Foods and start a very alkalizing diet. Picked up our green juices, and we're waiting in line, and this woman goes by. She's a caregiver to a mentally handicapped, and I think mentally retarded, handicapped person that was probably older than me in a wheelchair being pushed across Whole Foods. And that was my crossroad, that I'm like, you have your limbs, you have your mind, it is only cancer. And I knew I was not going to be self-pitied. That was my changing moment, that I just had to move forward. There's other people that are messengers and that have much harder life than what I was diagnosed with.
You're a beautiful, amazing woman, Wendy, and what we see here today is your lessons and your examples played out, and Dr. Harness played a big role in it. Dr. Harness, Wendy said that to me the moment that the lady went by in the wheelchair. She said, I just have cancer. That's it. It could be a whole lot worse. Now, one of the things that was our real guiding wisdom that we got, and we got so much that came from Dr. Jay Harness, and all these questions that we were asking are now on the website for you and your loved ones. But Dr. Harness said to us immediately, and he was on the phone with us the second Wendy was diagnosed. He was on my cell phone ready to talk with Wendy. But he said, time is your friend. Whoa, slow down, guys. Time is our friend. Dr. Harness, if you could, explain for the newly diagnosed patient why the moment you're diagnosed, why time is your friend.
Well, there's a natural panic, Todd, of wanting to do something immediately, wanting to have surgery immediately, etc. And the reality is, for at least 10 years, we've been in an era of what's called personalized cancer care, where we want to learn all the facts we can so we can tailor-make the treatment to exactly the specific patient and the specific needs. And the reality is, from the first very abnormal cells that began months and months ago, maybe even years ago, to where we're at today when I meet the patient, is such a long time period. Time is indeed our friend, because we want to make the right decisions, as we did in Wendy's case, based on the specific biology of her cancer, things like her Oncotype DX results, making decisions about surgery. So I try and embrace the patients and try and make the panic go away, have them know they're in good hands, and then let us do our job. But frankly, it takes maybe a few weeks to do our job.
On average, how long does it take, Dr. Harness, from biopsy to surgery? Is it like a month, 6 weeks?
No, generally, Todd, it's in the neighborhood of, maybe a couple of weeks. There's actually data in the literature that shows that time delay has absolutely no negative impact on patients. In fact, one of the myths out there is that doing a needle biopsy is suddenly spreading the cancer, which is absolutely not true. There have been studies done in the military in particular where there might be delays up to 6 to 8 weeks or longer, no negative impact. So what's critical here is to get all the data we can, the breast MRI exam, other factors that go into this, and then decide what's right for the individual patient based upon their individual cancers.
Now, Wendy, you went through a really difficult period. It was very scary. I was right there with you. What was the big lesson that you learned? It took us, I think, Lev, tell me if I'm wrong, about a month from diagnosis to surgery, right in that ballpark. What kind of lessons did you learn during that period?
Well, I did learn that I'm a very patient patient. And I think it's really through the art and practice of yoga, because it teaches you how to get to know your mind, how to learn the lessons of self-discovery, pay attention to where you're conscious and where you're not. And because Dr. Harness reminded me of time as your friend, any time through life, if I get into a state of urgency, I do not make good decisions. So the more I can move myself from an emotional state and kind of step back, give myself time to digest the experience before going back into it, gives me opportunity to make better choices and to realize what my choices are, because there's so many choices out there, especially from just interviewing different surgeons that resonate with you, to having doctors that carry the same belief system, and just part of your whole multidisciplinary team. You just want to make sure everyone is congruent with your own belief system, and I had that, and it was because Dr. Harness started it all, because of our resources here at Breast Cancer Answers. He educated us in what we're looking for, and that emotional bonding that you want to feel confident about who's helping serve you.
Boy, spot on, Wendy. I couldn't agree with you more. And isn't it fascinating that all the years that you've done yoga, all the years you've been teaching people, the years you've been doing massage work, and all of the wonderful things you've been doing really came to bear to help guide you actually through the process. And therefore, you are a guide now to others. Simply doing this live Google Hangout this morning and sharing your words of wisdom are helping to guide people as well.
I so agree, and it really, it was my testament of, am I practicing what I'm preaching? Can I be the student and can I be the teacher? However, I will say it was a little disheartening coming from a fitness and health and energy type style work background, that I'm like, oh, I have cancer, so I'm not doing something right. Maybe I can't give advice anymore. So I had that little moment of realizing that, guess what? The better you are at your teaching is when you experience the polarities of what you're teaching. So if I'm teaching health and fitness and I experience the opposite of it, I have a better understanding of where people come from. I'm a very self-motivated individual, and sometimes I put that on other people, that, hey, you should be able to get up in the morning and walk your dog and go for your run and cook your husband's breakfast and then get on with your work day and come back. It's just, I tend to put that into people's minds, that, you just keep the body in motion and it stays in motion. And when my body could no longer stay in motion, it allowed me to train differently, just like an athlete gets injured and has to sit on the bench and watch the game. they get to really analyze all the players, what's going on, just like the coach does. And therefore, if he chooses, or she, can really better who they are in the art of their training, and to train differently because they got injured, maybe because there's imbalances in mind and body or whatever. And I took that into my own. I said, okay, I need to train differently than what I'm doing. Maybe live a less hurried lifestyle. Maybe discern better at where I'm spending my energy. And therefore, not only did it make me a better teacher, but it made me a better student and a compassionate person. I am pretty compassionate, but it allowed me to just talk to that stranger, you know, at the airport or sitting on the park bench outside the coffee house, and have this deeper conversation, because I didn't look like I had cancer and I didn't have to share I had cancer, but I was coming from a whole different angle and perspective, and it was hearty and healthy.
Well, let me jump in for 1 second, because you just said something a moment ago that is really critically important that we talk about. You said, in effect, what did I do wrong? Wendy Hartley, you are singly the healthiest woman I know on this planet. And any time I've ever had the great fortune to have a meal at your home with you and Todd, I practically float out the door because the food is so incredibly healthy. But there is this point, what did I do wrong? And there are a lot of patients who are newly diagnosed, either consciously or subconsciously ask themselves that exact question. What did I do wrong? I've now got cancer. And the bottom line is here, you didn't do anything wrong. And the mystery of this disease will be unraveled more and more. And so you want to move away from any of the blame game, whether it's your family of origin or yourself or whatever it is, and do exactly what you're talking about, which is empowering yourself, being more reflective. And as you and I have talked about through the time, your life and the life of every breast cancer patient I know is changed forever. How you view life, what's important to you, your daily activities, what's on your mind, what's in the back of your mind, all of those things are changed forever. And I'm sure you're going to comment even further about how they have been changed for the better. Because I've had many patients say to me through the years, I never wished to get cancer, but wow, I'm a better person now that I've been diagnosed with cancer. You want to share about that, Wendy?
Absolutely, and I totally agree with you. I shared with my dad, and of course, you know, Todd, I said to my dad, I would not have traded cancer for anything, and he just sunk in his chair. He goes, really? And I said, Dad, it slowed me down. It woke me up. It allowed me to look at what my priorities are. I think, too, I'm so inspired by music and books and, you know, people that are just so empowering, like Dr. Harness, my husband, and our Wirebuzz team that works here with Cancer Answers and such. But let me get back on the path of the whole inspiration in making my life better. It allowed me to, I hit on it just a little bit earlier about discerning what I was doing. I tended to put other people in front of myself and forget about myself. And it allowed me to switch the gears, because if I'm not feeding myself first, it's harder for me to give wholeheartedly. And I started to notice I was getting depleted because I was coming from a backward angle. And I need to bring the quote in from Albert Einstein, because he said, like, the humanity's greatest question is, do you think the universe is friendly or not? Because if you think the universe is friendly, then therefore you're going to have the technology and the scientific resources, the natural resources that are going to put it into the art of play and work for you. But if you do not think the universe is friendly, that means that you probably think God is rolling the dice and you are just in random chance of what is happening to you. And if we're random chances, or if we're victims, we cannot empower ourselves. So I do love hospitals. I know people are scared of hospitals. Hospitals, when you look at it, there are ways most of us come in and go out. What more magical of a place is that? And people look at it as the scary part. And then you have people like Dr. Harness that want to help people heal and help their health, and they choose to be of like the greatest service of keeping them here on the planet or not. And we don't always have a choice if we're staying on, well, the doctors don't have a choice if we're staying on the planet or not. But where I'm getting at is, my viewpoint. I view hospitals as a very powerful place. So I let go of the scariness there. I let go of the victim because I see the universe as being very friendly, and I seek friendliness. And by seeking friendliness, I have to be that friendly person. I have to show up each day and say hello to a stranger. Or if someone looks like they're sad on the dog park walk without a dog, are you okay? No, I'm just hanging in there. Said, well, I'm sending good vibes for your day today. You know, just having that opportunity to share a little bit of what inspires me. And to put that into the act of cancer, what greater way to learn life than to be at the edge, like the edge of knowing that, hey, I find that people, the closer they are to death, the more alive they are, if they still have their faculties. And the rest of us, if we're just kind of going through our day and not really contributing, we get stagnant, we get bored, and we're not all that happy. But when we find things that inspire us, cancer helped me find a different way of looking at life, and it inspired me. Plus all the trailblazers. We have Annette Mattern here in the house, and she's trailblazed and lit the torch for so many of us. And Lisa Schneider Cipriano, I had two amazing women that already lit the pathway and already gone through it. So I was a seeker to make sure that I was finding ways to lift me up instead of pull me down. And if I did feel depressed, there was those moments I'd tuck myself into bed and put on a meditation CD and empower myself. So I wouldn't change it for the world. And it has made me a better person, and it's allowed me to look at people, you know, people that have chronic disease. I mean, cancer, there's some that are just so curable that you can get to the other side easily, but the people with chronic disease, carrying that in and out of their lives every day and not finding things that inspire them, I want to help them. I want to help them just ignite the flame and the torch that has been lit for me.
That's beautiful.
I'm really worried today, but I have so much to say.
Don't worry about it, love. You two are the most inspiring people in my life, and I couldn't be more honored to work with you two and to help people around the world, people we will never get to meet that are struggling on their journey. And I think we all know that this is a wonderful opportunity / responsibility that we have, and we're that much better for it. Dr. Harness, it's a unique experience. It's a very personal experience that people go through. There is shame. There's a lot of fear that gets developed. For somebody who's joining us right now, can you kind of paint the picture? What role does a surgeon play in this process in guiding the patient through their cancer journey in year one?
Yeah, there's a couple ways of looking at this, Todd. There are surgeons like myself, of which there are many around the United States and around the world, whose full-time passion and focus is breast cancer. I would say that the majority of us play several roles. What I tell my patients is, number one, I'm your advocate. I'm your number one advocate. Number two, I am your project manager. In other words, as we go down this journey together in the different steps, I'm helping to organize those different steps. Number three, when you eventually need surgery, I'm going to, in fact, be your surgeon. And then number four, I'm going to be involved with you long term. I'm in this journey with you. Now, I would say that my approach is pretty typical of those of us who do breast cancer full time. Clearly, I have colleagues, surgeon colleagues, who look upon patients as procedures. You know, do you need a lumpectomy or you need a sentinel node biopsy or whatever? Provide outstanding care, send you on, and the medical oncologist takes over a lot of the role that I'm talking about. So the role play will vary among the members of a multidisciplinary team. And then you take an institution like ours here at St. Joseph Hospital in Orange, California. We also have a patient navigator, and she's also a coordinator and an advocate and a go-between, etc. So for me, at least, there are multiple roles. One of the things that I talk about on my own website, drjharness.com, is the expression, we live you. Good grief, what do I mean by that? Well, what it means is I'm embracing you. I am here for you. I am taking that fear that I know that you have into me and letting you know that I am not fearful, that I know the pathways that we need to be on. We're going to make choices together, and we're going to do the journey together. And as I said, Todd, I have lots of distinguished colleagues around the United States and around the world. I'm confident that many of them have the same attitudes that I do.
You know, I've met many of them, and I don't disagree with you, but there aren't enough J harnesses in this world. And if we could replicate that, if we can get you to work with pulling together the clones, that would be a wonderful contribution to mankind, Jay.
Thank you.
One of the things that you wanted us, as we were going through our cancer journey, to do was to understand the biological makeup of our cancer and to recognize that cancer treatment isn't one size fits all. Can you share with the audience, bring us up to speed, where are we now in understanding the biological makeup of an individual person's specific cancer, and then how does that affect the treatment going forward?
Yeah, number one thing to remember, Todd, is that breast cancer is a galaxy of diseases, plural, from almost so benign that someday we may not even have to do anything about it, to all the way over to super aggressive, where we're sometimes can't even stop it. Vast majority of the patients fall somewhere in between. Now, I've been focused on breast cancer at the level I'm at now for close to 30 years. The biggest breakthroughs that we're making right now is at the gene and molecular level. A perfect example of this is the Oncotype DX test, where we do a gene analysis of the tumor in estrogen receptor positive patients, even some that have lymph node positive, and we did exactly this in Wendy's case. Because as we drill down to the molecular, the gene level, again, what we're realizing is there are hundreds and hundreds probably of different breast cancers. So it allows us to categorize patients, as we did in Wendy's case, that are not going to benefit from chemotherapy, who need anti-hormonal therapy after the appropriate surgery, you know, et cetera, et cetera. So it is a personalized process. There are many, many subtypes. Therapy is guided by the different subtypes. Of course, most of the patients who come to see me, the immediate fears that they're having are, one, am I going to live? And two, oh my God, do I need chemotherapy? And I know, Wendy, you probably want to comment on that because I know how fearful you were about that. And again, what I try and do is slow everything down and saying, we're not ready to go there yet, and yes, you are going to live. And Todd, the other thing that's so important that people understand, we have come a long ways, and what we want to do today is to maximize the state-of-the-art therapy that we know about today, knowing that it's going to change down the road, that it's going to, in fact, get even better. And so we want to maximize what we do today, and that's why for the 2 years or more that we've been doing Breast Cancer Answers, you constantly hear me say, work with a multidisciplinary team. Work with a center that is on or at the cutting edge of what's going on, the breaking news, if you will. And that's the level of care, you know, that you'll want to be at. But it is multiple diseases. One size clearly does not fit all.
You know, I remember being just a medical journalist dealing with cancer for a long time, and when Wendy was diagnosed, we thought stage was a really important factor, but it turns out that stage is a ever decreasing part of the equation. Can you talk about that, Dr. Harness? It seemed like before we were diagnosed, it was like, oh, what stage are you, when we'd always talk to people. But then once we were diagnosed, we rarely even talk staging. Can you explain that to us?
Yeah, let me go through the staging just very, very quickly. Stage 0, Todd, is called in situ breast cancer, meaning the cancer is confined inside the ducts of the breast itself, totally treatable. So that's stage 0. Stage 1 is, in fact, an invasive cancer where the cancer is grown through the walls of the ducts, shedding off cancer cells that can go elsewhere in the body. So we've known well over 30 years now that once a cancer is invasive, we do have to treat the whole body. And I'll get back to that in just a second. But stage 1 is typically a cancer less than 2 centimeters in size and lymph node negative. And, you know, if you look at the historic data, the odds of being alive 5 and 10 years from now with stage 1 breast cancer is 85, pushing over 90%. But remember, those are historical numbers, okay? So that's stage 1. Stage 2 is one of two things. Either a tumor bigger than 2 centimeters in size and or lymph node positive. Even one lymph node being positive now makes you stage 2. Again, the survival numbers are very high. Again, you have to treat the whole body either with anti-hormone therapy and or chemotherapy. And you have to do what's called local regional control. The surgery, the lumpectomy, the mastectomy, the radiation therapy, that's all about local regional control. But if you're invasive, we also have to treat the whole body. Stage 3 breast cancer then is one of two things: greater than 5 centimeters in size or 4 or more lymph nodes positive. Again, you're going up the scale here. Typically the prognosis, you know, decreases some, but again, we're doing great now, or we're doing much better, I should say, when it comes to stage 3. And stage 4 is that it's gone elsewhere in the body. And as we've been emphasizing recently, stage 4 is not a death sentence. There are many, many patients who are stage 4 who have been treated and are alive for many years. Again, that's all part of our progress.
Now, we just, you know, our audience is continuing to grow rapidly. Our social followers, just for Breast Cancer Answers, is somewhere around 700,000 followers socially, and which is just remarkable. And it's a real sign of the commitment and dedication that the two of you and the team here continues to put forward on these campaigns. And so we got a question submitted by Dave, and Dave said, Wendy, what was your key to coping with the emotional roller coaster involved in cancer? Can you answer that for Dave?
I sure can. And I think part of the mind training of being a yogi and an athlete was where I had to put my practice, but also I had to go back to a place of reference where I had something negative happen into my life and then change it for a positive. I had just graduated college in exercise science. 4 months later, my knee snaps on my hike. My knee snaps. I graduated in this physical degree. How am I going to use my body? What is going to happen to me? I had to train differently. I did all my training underwater. I was able to use my body. I was able to overcome what I thought was detrimental. So I had a place of reference in my life that I had something which I thought was negative, turned it. My handicap became what I started teaching, which was water exercise, and then soon to be a yoga instructor because it was less wear on my body, but it also was very helpful in my mind. Then I took that into the cancer journey, and when it was time for a PET scan, I had to sit there with the IV that's giving me radiation in my body and pretend I was an avatar running through the forest getting elixirs from the gods and just self-empowering myself. I had to play with my mind. Albert Einstein again. Imagination is more important than knowledge. So we can take everything and do all this self-study. And I love self-studying. And my teachers would tell me, when you're getting to textbooks, sit in your meditation longer. Wait for the answers to come to you. You don't have to seek them as hard. And that's really what it is, sitting with our emotions. When we sit with the roller coaster, we are in the driver's seat. We empower ourselves to try to see, where is this spike coming from? And we work with it and not against it. And we find teachers that help us, whether it's an athletic type teacher, a yoga teacher, or books that we can listen to, on the car, the audio, or we show up at lectures, or we go to cancer centers. There's so many cancer centers that are free to the community and mind, body, health. And I will tell you, I am more inspired by the people at the cancer centers, the patients, than I am inspired by the people that have the 10% body fat and are fitness competitors when I go to the gym. And also, the cancer center has much deeper conversations. You ask someone how they're doing, they'll share it with you, but often it's, I'm doing fabulous because I've been given another day. Go to the gym, which this isn't a bad thing, but I'm being told about how bad, you know, my girlfriend's shoes were the night before with her dress. It's just a whole different way of looking at life. And when you have one more day to breathe and you appreciate that one more day, you're going to find something about your mind and your body that you're going to link to make you a better person, because you're going to seek it. So, Dave,
yeah.
be the seeker.
Very good. And Todd, let me just add one other caveat here as far as coping. This is really an important question that I think you said it was Dave asked.
Yes.
I tell patients to surround themselves with loved ones.
Mm-hmm.
And for the loved ones to also understand that, in fact, they're on a roller coaster. That some days they're going to be up, but there's going to be a lot of days that they're down. And just have that loving presence of family, good friends, whoever it is, if nothing else, just to be there with you. They don't have to entertain you. They don't have to make you laugh, but to be there with you when you cry, be there when you're angry, because there are going to be times that you're going to be angry because you've been diagnosed with cancer, and now your life, in fact, is changed forever, and you're pissed about it. And there are going to be joyful times, just as Wendy is describing. So surrounding yourself with loved ones, family, friends, and others, I think is a key coping mechanism.
Yeah, I shared that with my doctor 2 nights ago. I said, I think the best part of cancer, I got to see my friends and my family so much more. And a quote that Annette Mattern gave to me the day after I was diagnosed, she said, Wendy, there are only, you have this boat. And there's only so many people you can allow in this boat that empower you. And there's only so many seats. And the other people that don't empower you aren't allowed to get in your boat. So you just let that boat go with the people that are going to back you. And the people that disappoint you, they stay at the shore.
Yeah, that's great. I remember that. I loved that advice. You know, Dave asked a really important question, and I'd like to contribute also. He said, you know, what is your key to coping on the emotional roller coaster? And for me as the husband or as a caregiver, the way that I coped was I made sure I went to every appointment. We had to go through this together. Regardless of the outcome, we were going to experience it together. We needed to strategize together. We needed to understand the complexities. It's impossible for the patient to process and assimilate all the information that they're given. So we turned all of our doctor's appointments into dates. They were little mini dates. We would go, we'd sit in the lobby, we'd totally forget that we had cancer, and the next thing you know, we're having fun and we're laughing and telling stories. And then
Todd's getting a private yoga instruction in the waiting room because we're waiting for the doctor.
For the doctor, Wendy's giving me private yoga, and I'm standing like this in the doctor's office. We're making the best of it, but we're doing it like we've done everything. We're doing it together. And so I recommend, Dave, that if you're looking for a way to help ease that roller coaster, get on board, be a part of the ride, and make sure you can be there as somebody to help guide, because there's going to be times where your loved one is really struggling up here, and you could tell them about the great numbers that they're getting or the positive results and help shape them and bring them back up. So that's a caregiver advice right there.
Yeah, Todd, let me just jump in, because also part of that of having the other person there or other persons is the patient can't take in all the information we're sharing. And I actually insist that a breast cancer patient, particularly during the first 2 to 3 visits, always have somebody else with them. The brain is overwhelmed when they're, especially the first visit. I mean, patients can barely remember 10% of what we said, which is why you and I have created the Inform system as a way of following up with videos to patients about what we talked about. But it's critical not only as a support process, but also as another brain, another eyes and ears, and even tape recording the conversations so you can replay it. But yes, this is a journey you do together. This is not a journey you do alone.
And listen, I know you both have very busy days today. Dr. Harness is in the office. He's got patients that are going to be coming in shortly. So in the closing moments, if we could, I'd like to go around the room, and if you could give one piece of advice you'd love to give to a patient on, in honor of Wendy's 1 year from diagnosis that we're celebrating today. And let's start with Dr. Harness. Let's, of course, end where it all began, this conversation with Wendy. So, Dr. Harness, one piece of advice that we haven't shared already that would be valuable to a patient and a loved one.
Yeah, it's called empowerment. Continue to empower yourself with knowledge, empower yourself with friends, empower yourself with loved ones, and work with a multidisciplinary team. I've made these points, but I'm simply reiterating them because I think they're really critical, Todd.
And I gave mine earlier, which is go and make it a date and have fun and do it just like you've always done with life. Embrace what you're going through, but be that support for them. Wendy Hartley, in closing, what piece of advice could you give on this special day?
Remember what inspires you, because to be inspired means to live in spirit, and spirit helps us with our physical ailments because it's the bridge that links us to our empowerment. And I had more time to read the books that I love and listen to the meditation CDs. Prior to surgery, I was doing water workouts that made me feel weightless and energetic and helped me go strong into my surgery. My surgeon was very happy that I was working out, and he goes, just stay healthy with your eating and don't lose any weight before going into surgery, and just things that made me feel wonderful. And it allowed me to take that wonderful feeling into a journey that I didn't know how it was going to turn out, but I had a feeling just through the art of surrender and knowing that if the universe is friendly or not, things will turn out even better than what you expected. And that's truly what happened. Things turned out even better, and because I'm a better person because of it, and it enlivened me. It woke me up, and it helped change my value system.
Well, look, I'm a better person because of the two of you. And Wendy, if you could sit in my seat today and watch you shine, if you could look at Dr. Harness's face while you're talking and seeing him just so proud of where you are today. We've become Dr. Harness's kids through this process. And he nurtured and guided us so we could be here today, to be filled with smiles on our face. And, there's an endless amount of thanks and praise that we could give to Dr. Harness. And the one off the top of my head that I would like to share is, Jay, you really were there to talk us off the fence every night, and we needed that. So please know how much that means to us, know how grateful we are, and that we listened and we learned and we absorbed your advice. And you can see from how dynamic this girl is and how much of a great experience it was, that your lessons really affected us the positive way. She said to me the other day she was getting out of the shower. Now, for some, this might be too much information. But I want you to know that this is about breast cancer answers. And Wendy got out of the shower, and she stood there, and she said, I'm so happy with how all this turned out. Right? And that's because you gave us answers and guided us. So on behalf of Wendy and I, we thank you from the bottom of our heart, and we can't thank you enough. So we really appreciate it, Jay.
Thank you. It's truly my honor.
Yeah, we know. We see it. And so on behalf of everybody here at the Office of Breast Cancer Answers, my loving wife, survivor of going through all this chaos, and Dr. Jay Harness, we wish you all a very healthy, happy day full of, you guessed it, cancer answers.
Woohoo!